separate lectures, but just their definition so you can get started, and when these terms come up, you at least know what that means. So with this, let's start with the heart. So the USMLE wants you to know what are the heart's chambers, what are the valves, how does the blood flow in those chambers. So this is that lecture. So let's start from here. The heart here that is drawn, and you'll see a picture as well. It has 4 chambers. The 4 chambers are, number 1, if the right heart, right atrium, RA, and left atrium. That is one functional, these are 2 chambers but one functional unit, also called the right heart, the right heart. Then of course left atrium and left ventricle. That makes 2 chambers, left atrium and left ventricle, but that also makes the one functional unit, that is left heart. So I'll make that here. Left heart, consisting of left atrium and left ventricle. The right atrium has 3 inputs. Superior vena cava brings the blood from the head and neck area, superior vena cava. Inferior vena cava, IVC, brings blood from the rest of the body except the heart, and the coronary sinus, that brings blood back from the heart, coronary sinus. Now remember, heart receives blood to do 2 things. One is it receives blood to pump it out, so that's the pumping function, and the second is it receives blood to use it as its own nutrition as well. So when the heart is pumping the blood, the vessels on the right side are superior vena cava, inferior vena cava, and the coronary sinus. They bring the blood that is pumped out through the pulmonary arteries. So this is pulmonary artery. So here a quick definition of artery. Arteries are all the vessels that bring blood out of the heart, that bring blood from the heart outside towards the tissue. So this is the pulmonary artery that would bring the blood out from the left atrium, right ventricle. Okay, so that is the pulmonary artery, that is the right side. The left side has left atrium, left ventricle. The blood comes in through pulmonary veins, and the definition of veins is all the blood vessels that bring blood to the heart. So pulmonary veins bring oxygenated blood to the heart. These are veins. It is not necessary that vein has deoxygenated blood. Pulmonary veins bring oxygenated blood from the lungs to the heart, and so these are oxygenated blood carriers, but are veins because they are bringing blood to the heart. Okay, so left atrium and left ventricle. Left ventricle in turn pushes the blood or pumps the blood into aorta, and then aorta is connected to the systemic tissues. There are 6 major systemic tissues that you should know about. One of them is cerebrum, or the head and neck area. Coronary tissue, that is the heart itself. Splanchnic tissue, that means GIT, that is intestines, liver, spleen, etc. Renal systems or kidneys, skeletal muscles or just the muscles, the skin, and that makes the systemic tissues. Alright, so now these are the chambers and the